Hello everyone, I'm Dr. Ashok. I'm a medical officer from Malaysia, Iskandar Puteri. In conjunction with Father's Day 2021, I'll be having a health sharing session with all the fathers out there, how to maintain your health. A father is the head of the family and a role model to the kids. So it's important to take care of your health so you can take care of your families. I will share with you some tips on how to maintain your wellness and improve your health. Join me in our session. Doctors Go Live to know how to take care of your health as a fellow man.
Thank you again for being with us on Doctors Go Live. So as we all know, this month is going to be Father's Day month. So let's take a look at a topic that is very relevant to the season, which is about men's health. We all love our fathers, we all love our grandfathers, our brothers, husbands, of course. So anyone who is anyone at all, who are men, this is the episode that they should be listening, they should be tuning into and paying attention to, because we have an expert in the house. He is also a father himself. Please welcome Dr. Asokumaran Moorthy from Columbia Asia Hospital, Iskandar Puteri. He is the medical officer there. Betul tak, doctor? How are you?
Hi. Good afternoon.
Good afternoon to you. Thank you so much for being with us. Good. Because we know that you are very busy. So for you to make time to be with us today, it's very good of you. So thank you very much.
Yes, thank you very much.
Okay, doctor. So today we're going to be talking about men's health. I understand that from light research, number of deaths among men due to heart diseases is more than double compared to women. Is that true?
Yes, absolutely. I agree with the statement. So according to the health statistics, the men are more prone for the health issues, especially on the ischemic heart disease. So
right, I see.
Yes.
So this is the major cause of death in Malaysia. Maybe we can start off by, I understand that you've got some slides. So maybe we can just take a look at that first.
Sure, thank you.
Okay, all right. Wait, before we start, I would just like to mention to the viewers that if you all are following this, good for you. This is congratulations. You can also ask your questions in the comment section. You just type it there and then the doctor will address the questions later after we have finished today's presentation, okay? So don't forget, stay tuned, no commercial breaks. We're just gonna start.
Thank you.
And you can also send in comments if you want, emoticons and whatnot. Okay, sorry doctor, I've been interrupting you. Okay, please do start. Yeah.
Okay, first of all, I wish everyone, every fathers out there, happy Father's Day. So today we will discuss about men's health. How are you all today? Hope you're doing very fine today. So do you know your life is your choice? So obviously, everyone will prefer to be healthy and functional. So let's go through what we can do to optimize our health. So according to statistics, men are more susceptible to have ischemic heart disease. So about 50.56% of our total mortality rate is associated with ischemic heart disease. So cardiovascular disease is the top killer. We can see the males are comprised nearly 4 in 5, about 78.8% of hospital admissions for heart attacks.
Yes.
And the average age of the Malaysian suffering of the heart attacks is 58.5 years old compared to the other nations. And around 1 in 4 heart attacks patients are less than 50 years old. So nearly half of the heart attacks, about 45%, have a 3 or more cardiovascular risk factors like being obese, having high blood pressure, having diabetes, being smokers, and also having abnormal cholesterol levels. So this is very worrisome. And the death rates for the heart attacks are still considered high in Malaysia, about 10.6%. Heart attacks involving percutaneous muscles.
Is that the leading cause of death in Malaysia? Heart attacks?
Yes, leading cause of death in Malaysia.
Among men?
It's about, yes, among men. Yes, correct.
Oh, I see. Okay. What about worldwide? Is it the leading cause of death worldwide?
In worldwide, yes, correct. In worldwide also is the leading cause of death. About 68% of the total of the deaths associated with non-communicable disease, and number one cause of death we do it usually associated with ischemic heart disease.
Okay, so let me just concur. You think that cardiovascular diseases, this is the major cause of death in Malaysia, number one, and then the major cause of death among men in Malaysia, and then
Yes.
globally it is also the leading cause of death.
Yes, correct.
Wow. Okay. All right. I mean, wow, as in terkejut lah, not like wow. Amazing. Okay.
Yes.
So let's take a look at the next slide, shall we?
Yes, correct. So, as I told before this, the non-communicable diseases like cardiovascular disease, stroke, diabetes, hypertension, all this leading
Yeah.
cause of death, about 68% of the total mortality rate of the in the world.
Right. Okay. And so we have to take
So I
care of
really plead to all the nations. So please take care of your health. Yeah. So as per definition,
how would you define that, doctor? How can we take care of our own health? This one, man or woman lah?
yes, but
Right. Okay. Either.
as per told, men is more susceptible to the ischemic heart disease. So I just instill the awareness among the men about the importance of taking care of their health. And according to the WHO, health is a state of a complete physical, mental, and also social well-being, and not merely an absence of a disease or infirmity.
Okay.
So,
right.
Okay, so take care of your body. It's the only place you can live in, and everyone is responsible for their own happiness. Okay.
Yeah.
So today I will be focusing on a few chapters, especially on the obesity, cardiovascular disease, hypertension, ischemic heart disease, stroke, diabetes, cancer, prostate health, depression and anxiety, and also prevention, and also on a healthy lifestyle.
That is very good. It's very, very helpful to know all these things because these are very common diseases, kan, doctor?
Yes, correct.
Macam best friend pula dengan doctor. Okay.
Okay, we will start on obesity.
Right.
Okay, obesity is the starting point for every trouble.
Okay.
So we go on definition of what is obesity. Obesity is an increase in a body weight because of the excess body fat, and usually be associated with the overeating and increased calorie intake. So obesity is preventable, and what we can see is the world is getting fatter. What it means when we go back in 20 or 30 years back, the amount of 250 million of people are affected with this problem, but the number steadily increasing. Even we can see it's drastically increasing in recent years, where most of the people are getting trouble with this obese problem.
Yes.
Okay. How do we know we are obese or overweight? Usually we classify them with a BMI index. So BMI is calculated by the weight divided by the height square. So more than 35 will usually associate with the severe obesity. So these are the indexes we need to be taken into account to classify our level of obesity. Okay, so ABC to prevent obesity is usually we advise them to adopt our new healthy habits, balance our calorie intake, and also control our weight gain. Several health conditions will affect because of the obesity. There is a stroke, heart disease, diabetes, pancreatitis, arthritis, gout, liver diseases, lung diseases, even sleep pattern also be affected because of the obesity. So this is really worrisome, and that's why every trouble, as I told before, every trouble is starting point is obesity.
What if you are behaving as if you are going towards obesity? That means you are eating a lot, you're not exercising, but you are not, but your BMI is normal. I guess some people, they have that kind of metabolism rate and that they think they are okay because they're gaining weight. Should they also be worried about their health condition ataupun they are selamat? Like,
definitely they have to be worried of this kind of condition, overeating or calorie intake. Even though we don't see clinically or even the physical appearance
Yes,
doesn't
yes.
show, but definitely when we see the blood parameters, the increased level of cholesterol, especially LDL and everything,
Correct,
definitely will
correct.
affect our health condition. So doesn't mean physical appearances, but definitely when on the last part of the lectures, I'll let you know what kind of test to determine on to
Okay.
make sure our health is in the peak
All
of the
right.
health.
Okay. Awesome. All right. Let's do that. So
So
facts
next,
about obesity.
yes. So
How
next,
can we prevent obesity, doctor?
how we prevent obesity? Usually, we'll advise them to do a regular physical exercises, take care of our weight gain, and also limit our alcohol and caffeine intake, and also reduce stress and especially quit smoking.
Okay. All right.
So
Okay. Now we're going to be
cardiovascular
talking about
disease, yeah, correct.
yes.
Approximately 450,000 men die of cardiovascular disease each year, and cardiovascular disease is a blanket term which include three major types of diseases: hypertension, coronary heart disease, and also stroke.
Oh,
So I'll go on
I
detail
see.
on each major type of diseases.
Oh, I've always thought that cardiovascular disease just means heart attacks, heart diseases. So cardiovascular is actually a group of diseases that's interconnected.
Yes, definitely. It's a group of
I
diseases.
see.
It's a blanket term used for hypertension, the coronary heart
Okay,
disease, and
hypertension.
also for stroke. Yes, correct.
Stroke. Okay,
Yes.
hypertension, coronary heart disease, and stroke. So that is cardiovascular disease. Okay, got it. All right. What is hypertension, doctor?
Hypertension. Usually, we need to know our numbers, so we go back to the basics. So everyone, it's a classified as a optimum, a normal, high normal, stage 1, stage 2, and also stage 3 of a hypertension. So when we
Oh,
see what is optimum level of hypertension, is actually systolic pressure should be less than 120, diastolic should be less than 80. Meanwhile, the stage 3 or hypertensive crisis will be the blood pressure of the systolic will be more than 180, and
yeah.
diastolic will be more than 110.
How do we know as an average person about our blood pressure? Macam you were mentioning systolic and all that, but if I'm just an ordinary man, in layman's term, how can
Okay.
I about my blood pressure if it's healthy or not?
Okay, so when we go to the clinics, or even we can check our blood pressure in the home. So when we see the
Oh, okay.
yes, so when we see the numbers, so usually we divide into two numbers. The first number is usually systolic. Systolic is the pump. I mean the heart is pumped, and also diastolic will be the resting stage of the period of the number. So when we say the number of 110 below systolic means normal, 80 below is diastolic means we want an optimum number. So if it's normal, 120 is 80 is normal. Above than that,
Yeah,
usually 140 and 90 above is actually hypertension. Means the borderline hypertension is started already. So we
I
ask them
see.
to do a regular blood pressure monitoring at home weekly, and we'll see the average number, and then we will classify them whether they are starting the hypertension or not.
Which number should we be looking at, the systolic or the other one?
Actually,
Diastolic.
both numbers are equally
Oh, I
important.
see.
Yeah,
Okay.
so we will see both numbers, and then we will classify them accordingly.
Okay. Okay. Any symptoms for us to know if we've got hypertension?
Yeah, even though it's generally said a silent killer, but there are few
Mm.
symptoms we usually take into account. So, like common symptoms are headache, especially at the back of the head. We call it occipital type of headache, and then
Yeah.
ringing or tinnitus in the ear, and also palpitations, numbness hands and the feet, vertigo or dizziness, fatigue and
Yes.
insomnia, and
Yes.
also uh, several conditions. We have seen a nosebleed, and then we have seen a elevated of the blood pressure, and also
Yeah.
nervousness. So definitely we'll have complications of hypertension through to the major organs, especially on the heart, brain,
Yeah.
kidneys, also the eyes, and also vessels. So where we can see the manifestations on the heart, you'll have angina pectoris. The brain will have a stroke. On the heart, you have a hypertrophy on heart failure, even a myocardial infarction. and also peripheral artery diseases of the legs and renal insufficiency will lead to the renal failure and also retinopathies.
It's very serious diseases. Okay, and what about coronary heart diseases?
Yes, a very good questions. But coronary artery disease is a very important topic to be discussed because when we see the blood vessels of the heart, they are very narrow compared to the other organs. So it's a tendency to develop the plaque or cholesterol plaque in the artery is very, very high. So when it develops, it won't develop abruptly. It will develop in the long term and definitely will give symptoms on the later on. So when the plaque build up in the artery, and definitely at one point of stage, it will block the blood flow and will cause the dead muscles, the heart muscles will get a lack of oxygenation and definitely will lead to the myocardial infarction. So when we go to the other slide, we can see the blood flow in the normal coronary artery. Meanwhile, coronary artery with the atherosclerotic plaque and also total block of the artery, reduced blood flow and will cause the myocyte damage. That's the condition we call myocardial infarction.
I see. Okay. So when you reach this, okay, there are three images here. The image that is on the far right.
Yes.
Where you can see the artery is closed down because it's been blocked by fat. I'm not sure what that is. So this is when heart attacks happen?
Yes, when the total the supply of the blood supply is obstructed, occluded by the atherosclerotic plaque, and definitely that's where we call it myocardial infarction, or in the general term heart attack happens.
Okay, so this is how coronary heart diseases happen when there is age.
So how we actually diagnose? Usually we use a simple method. We call it when we have a chest pain, chest discomfort, shortness of breath. We usually will do a baseline ECG for everyone. So at that moment, there's several patterns classical for the heart attack or myocardial infarction. When we detect that kind of pattern is alarming, and we need to act aggressively and need to treat the patient to prevent that immediately. So there are several other investigations apart from ECG. We can do coronary angiogram.
All right.
So coronary angiogram is a type of method where we can insert a catheter through the leg, guided to the aorta, and also we can inject contrast agents and to see any stenosis in the arteries. So at the same time, when we perform this thing, we have two things. One is the diagnosis, another thing is the treatment. At the same time, we will do a procedure, we call it PCI, percutaneous coronary intervention, where we will place balloon or stent to widen up the artery.
This is young balloons with stents. This is what?
Correct.
Oh, okay. You know, certain terminology you hear, but you don't know what they are.
Yes.
That means it must be a very common occurrence. Okay, carry on.
So this is we call it PCI. If it's very severe stage and all, we will proceed with coronary artery bypass grafting of CABG. So this is the procedure, we call it CABG, for the very, very bad stenosis and all. So we will do the bypass surgery.
Okay, so between ECG and then angiogram, PCI, CABG ni semua, the one that is least invasive is ECG because that was just the machines and the reading will let you know. Okay, and the extent of it, the extreme one is CABG because it's actually surgery.
Correct. The surgery will be reserved for very, very bad stenosed arteries and also we will do the CABG.
Okay.
So
we must know how to prevent all these heart disease. Which is why
that's all about lectures today, to prevent.
Yes,
so that's why we will do all kind of a necessary investigation to make sure our think of the health. Yes.
Yeah. What about stroke, doctor? What are the warning signs of stroke?
Yes, another topic is actually stroke. Stroke is by definition is actually sudden brain damage, lack of a blood flow to the brain. Just now we talk about the lack of the blood flow to the heart. This one to the brain. So whereby we will classify the stroke into two major types: is ischemic type and also hemorrhagic type. So ischemic type is actually mainly caused by the blood clot and makes up about 87% of all strokes. Hemorrhagic is a bleed, accounts about 13% of the strokes bleeding around the brain or even into the brain. So we will have a clinical manifestation of the stroke whereby we'll have a mnemonic fast. So fast means F stands for the face drooping, A for the arm weakness, S for the speech difficulties, and time to call. So we need to act aggressively because time is very important to treat this. About 6 hours duration, we need to do thrombolysis or thrombectomy to really prevent the further damage to the brain. So there are several types of investigations, but the main type of investigation actually CT brain and also MRI or MRI to determine what type of stroke the patient is having with the clinical manifestation on the background.
Doctor, when you have the hemorrhagic stroke, does that mean you will need to have a fall first before this happens?
Not necessarily. Even as we go back to the basics, high blood pressure, the readings more than 200 or systolic, diastolic more than 100 will cause a spontaneous bleeding into the brain. So this hemorrhagic type of the stroke. Bleeding is a traumatic type. This is a hemorrhagic, even a spontaneously can happen.
Okay, all right. That's a rupture.
Rupture of the blood vessels, correct.
The blood vessels, okay.
Yes. Ischemic stroke is the blood clot occluding the blood vessels and disrupting the blood supply to the brain and will cause neurological deficit.
I see. Okay.
Yes.
Clear. Fantastic. And what are we looking at next?
And next, we will look into the diabetes. It's the most common and problematic.
Very common.
Very, very important topic. Diabetes is a killer. It's a silent killer which kills part by part of our life. It's like a serial killer like that. So diabetes, as per our understanding, there's no cure for diabetes. However, it can be managed and treated about 90% of the time. Diabetes can be prevented before it starts. So we can see diabetes is the leading cause of disease, stroke, kidney failure, and blindness, and even amputations.
Okay, so this is a lifestyle disease, right, doctor? Because we're looking at the food that you eat, whether you get exercises or not every day.
Correct. Definitely, I agree with you. It's such a lifestyle disease. Once the lifestyle is getting sedentary and all, so it's open the entrance for the diabetes, and we will conquer our lifestyle and also our system slowly.
Can you give one piece of advice if somebody likes to eat sweet things? Because sometimes, you know, a lot of us have we have sweet tooth, and then all the desserts, especially now when there is MCO, people send food to each other. It's usually cakes, donuts, you know, all this good stuff.
So usually the awareness is very important. So we need awareness of this disease, and definitely came back to the basics. So the age of the eating all these kind of sweet stuffs and also the fatty foods, it should be controlled. Self-monitoring, self-control is very important. So key of prevention and treatment is actually we need to get more ourselves involved in the physical activities and to get more into the healthy eating, also balanced diet.
What if one person takes a lot of sweet stuff but then they don't exercise? Ataupun another, they exercise but then they don't take they eat a lot of sweet stuff, or does it have to be together? Like you have to actually be more aware comprehensively with your lifestyle and not just depend on one thing? Because some people they don't eat healthily, they eat a lot of fat, but they feel that because they exercise, so they're okay.
No, that's a wrong concept. So everything should be in order. So once they go into exercise, at the same time they need to take care of their diet as well. So both of things follow. So they will come together. So healthy lifestyle together with a healthy eating diet is very important. You cannot just take into one in consideration and neglect another one more. Okay, so two things should be
together. Okay.
What we can see, the common symptoms of a type 2 diabetes. So we will have usually will have a slow healing of the wounds, constant hunger, frequent urination, numbness of hands and the feet, unexplainable weight loss, sudden onset of fungal infection, itchiness, and skin and genital areas, and blurry visions. So these are the common symptoms of type 2 diabetes. When they have these symptoms, they usually cannot neglect the symptoms. They have to approach medical personnel to get themselves tested.
Okay. This is type 2 diabetes. What is type 1 diabetes?
Type 1 diabetes is actually autoimmune disease is caused by destruction of beta cells in the pancreas. So when we go into details, usually this type 1 diabetes is usually manifested in the younger ages compared to the type 2 diabetes. When we even 1 year old, even like common ages usually 12 years old, when they come to the emergency department with the sudden onset of loss of consciousness in the house and all, then suddenly we check the sugar level is very high. So that's what we call type 1 diabetes, whereby they have to be really in insulin therapy for lifelong. Type 2 actually, as Madam Sakina told just now, is actually lifestyle disease. So when we go,
you develop lah.
Yes, it develops slowly.
Right, I see.
And as I said, serial killer, it will slowly chop off all kind of important organs in our system.
Wow. These are things that because you don't see it happening right away, like if it's a rash and then you treat the rash and it goes away, but this is something that you cannot see. Macam you mentioned just now, like silent killer.
Yes,
it will hit you before you even realize anything happened.
Yes, definitely. That's a correct term we can describe about this.
Yep. Okay, so that's about diabetes. Diabetes management, maybe you can explain a little bit about how one can manage diabetes.
Yeah, usually we'll go into the triangle of diabetes management. The triangle consists of basics: exercise, diet, and if you really diagnose as diabetes, you have to be on medication. Very important. You cannot deny the facts that diabetes is curable. So you have to be under control. You have to take the medication accordingly, oral hypoglycemic agents or insulin, according to your physician. So you just have to continue the medication. Glucose monitoring is very important.
Doctor, if you manage it well, because diabetes is not curable, it's a lifelong disease, right? That means you get it and then you live with it. So if you manage it well, you will most likely end with diabetes anyway. I mean, towards the end of your life, you will still have diabetes, but it is not something that will eventually cause death. It can be other things that cause your death, even though you are having diabetes.
Yes, if you have a diabetes is a condition whereby you will have a manifestation in the organs like kidneys, your peripheral vascular vessels, your heart, your eyes, and everything. So slowly will give a manifestation in these organs. But when you have a good glucose monitoring and all, so a lot of complications can be preventable. So especially your diabetic wounds, as in those diabetic food kind of problems and everything can be preventable if your sugar control is very good.
Okay. So diabetes management is very, very vital if you have this
disease.
Very
vital. Yes, agree with the term.
Okay. All right. Maybe another time you can come and talk to us also about diabetes in general, because
it's a very big topic.
More about management.
The opportunity to talk about the diabetes, definitely I will do that.
Yeah, that's great. Okay. Now cancer. Wow, this one is.
Yeah, we will go
into very scary.
Another goal of the major problem we are handling in this kind of modern era is actually cancer. Approximately 700,000 men are diagnosed with the cancer each year, and nearly 300,000 die of it. Is a very sad condition. What we can do, actually recognize the risk factors. Smoking, family history is very important. 55 years or older, cancer in the past and everything. These kind of details are very important to diagnose early stage of the cancer. So early detection, notify a doctor if you notice anything unusual or abnormal, reducing the risk, especially on tobaccos, eat a healthy diet, stay active, and avoid sun protection.
Doctor, the risk factors that you mentioned just now, does this include for prostate cancer as well, or just all cancers in general?
In general, all the cancers, but for the men, I have to mention that about 50% of the cancer is associated with the prostate, about 41%, also colorectal cancer, about 11%. So for a men, these two cancers are very important. So we will advise them to do a screening for these two type of cancer. Even nowadays, for the health screening packages, prostate screening and also colorectal screening is included. So we advise them to do early detection is very important.
Okay, sorry, let me clarify that again. So cancer among men, the number one cancer among men is prostate cancer, followed
Yes.
by colorectal cancer.
Yes.
I see. Okay.
So that's why the prostate health is very important. So I'll talk about some aspects of the prostate health.
All right. Okay.
Correct.
Okay, let's take a look at the next slide. Types of cancer.
Yeah, correct. So the prostate, about 41% contribute to the. I mean, the 41% out of all of the cancers, the prostate is a very high. So when we get the prostate health early detection is the key. So usually we advise them to get a baseline prostate exam, usually at the age of 40 or even earlier. Consult your healthcare provider about yearly exams after 40 years old, and usually ask your healthcare provider about the prevention tips. And another condition, we call it benign prostatic hyperplasia. Progression can be very slow, but it can be treated at the early stage. And then prostatitis, there are a number of treatments options as well. Okay, what are the symptoms?
Cancer happens to men after 40. Generally, have you heard of it happening to anyone younger than 40?
The usual age is 40 above, but younger than that 40 is usually testicular cancer. We have noticed that testicular cancer, but then prostate cancer usual age is more than 40 years old. So that's the time where we advise them to get the health screening to be done.
Would you say, especially if they have a history of prostate cancer in the family, or they are if they are smokers, would you recommend them going for prostate screening every year?
Yes, so they have to go to do a blood investigation, especially prostate surface antigen. They need to check the antigen level, and also we'll advise them to do a basic ultrasound to see any enlargement in the prostate gland or not. And then other symptoms like difficulty in urinating, frequent urination overnight, burning sensation when urinating, and when they notice blood in urine or semen, and chronic pain in the back pelvis. These are the symptoms we can associate with the prostate problem. So together with this thing, with the blood test and also the ultrasound, will give us a clear picture of this disease.
Okay. So this disease, if we catch it early, is there a possibility of survival for the patient?
Yes, definitely good prognosis. So when we catch it early, then we will have a medical treatment or even surgical treatment, and then followed by radiotherapy, chemotherapy. It's a good prognosis if we detect early, and good chance of survival as well.
Okay, all right, that's good to know. So the key word here is actually prevention is better than cure. Go get your health screening for prostate, guys.
Yes, correct.
And this is available at Iskandar Puteri, right?
Yes, definitely. Not even all over the branches is available.
Yes. Yeah. Okay, so let's talk about the next ailment, depression. Yang ni pun interesting ni.
Yes.
Especially now, MCO, all the challenges that we're facing.
Yes, that's why
what is depression?
Especially add this slide as because depression in men is underdiagnosed. Usually men try to hide more feelings compared to the women. So I just have to, with a proper diagnosis and treatment, the vast majority of the men with depression can be helped and will go to normal and happy lives. And doctors are more likely to diagnose depression in women compared to the men. So it's important. Depression is actually underdiagnosed in men.
Yeah.
But then men are over 4 times more likely to the woman to commit suicide. So we need to help men in getting out of this depression topic.
Okay. Well, that's shocking.
Yeah.
It's shocking for anyone to want to commit suicide, but it's men more than women. Okay.
Correct. Stress does more than make you sick. It destroy your peace and hope and dreams. So there are several methods where several tips you can do, actually tackle the depression. Even you don't realize actually it's starting slowly, but if you talk to someone closer to you or even
Yeah.
people personal, actually we can uh, detect early symptoms of a depression and we can manage it successfully and can bring up the person
Yeah.
from getting too depressed. So we need to have a several important techniques to cope with the stress, especially we do regular exercises,
Yeah.
aerobic type of exercises, eat
Ah,
healthy foods, don't self-medicate, ease up the caffeine habit, get some
yeah.
good sleep about 8 hours a night, and then take deep breathing exercises and actually
Yes.
advise them to relax and have some fun. So these are the tips where patient, men can do to reduce the stress. Even some other methods we can actually advise them, like a meditation,
Yes.
biofeedback, self-hypnosis, breathing exercises, proper nutrition,
Right.
relaxation.
Right.
So these kind of things they can actually apply to themselves to
Mm.
cope with the stress or anxiety disorder.
Yeah. Doctor, when you mentioned anaerobic, no, you said aerobic exercises, right, just now?
So, correct.
Reason why you mentioned aerobic rather than anaerobic?
Aerobic exercise, usually you do type of exercises where you sweat,
Cardio. Cardio
cardio,
exercises.
cardio exercises.
I see. Okay. Okay.
These kind of exercises
All right.
will
All right.
make you like you feel better. When you sweat, you feel more better, and so that's
Correct.
why we
Yeah,
suggest you
betul.
do more aerobic exercises.
Yeah. In the pink of health, so you're happy because you've just exercised. You feel
Yes,
good.
correct. So, do you see a trend here?
Trend overall?
Yeah, overall, we have found the best approaches to helping
Yes.
men lead healthier and a fuller lifestyle consists of few simple steps. So
Mm.
basically, we
Mm.
advise them to see doctor regularly, ask
Yeah.
questions. So there are a lot
Yeah.
of questions you keep inside your heart. So you have to be more transparent. Ask questions to your physicians. Eat a healthy
Mm.
diet rich in fruits,
Yeah.
vegetable, whole grains, and low-fat foods.
Yes.
Exercise about 20 to 30 minutes a day, 3 to 5 times a day per week. So make it a regular. So you cannot do like a one day and then skip for a 1 month. You have to be regular and then consistent. That's the keyword,
Yeah.
consistency.
Yeah. I think it's a matter of getting a routine going.
Yeah, routine is the
That is
perfect
the
word.
most difficult. Yeah. It's to
Correct.
begin. Once you begin, you get it done over a few days and a few weeks, and then you hopefully lah, it
Yes, and
becomes
then
already.
maintain a healthy weight, get a good sleep, manage your stress, and most important thing, get help if you need it.
Yeah. So what you mentioned just now, this is the trend that you're referring to because most of these points are relevant in cardiovascular diseases, in diabetes, depression, everything that you mentioned just now, all has to do with the way you eat, whether you
Yes, correct. The keyword is lifestyle modification.
correct. Yes, lifestyle
So when
modification.
you modify your life, definitely there is a light at the end of the tunnel. So we will get everything in order to get our health status in the pink of the health.
Okay. So a lot of it actually really does depend on the person himself lah.
Yes, definitely. So we will ask them to get back on the track, do a regular exercise, take care of your food, everything will be in order.
Okay. All right.
So
Now, doctor, I understand that. Sorry, say again.
how are we going to prevent these things?
Yes. General
Yes,
tips for health problem prevention for men. Here we
yes,
go. Okay, all yours, doctor.
yes.
Idea.
So usually we'll ask them to get an annual health examination, visit your healthcare provider every year, know your
Yeah.
numbers, PSAs. I told you prostate surface antigen, cholesterol, glucose,
Mm.
blood pressure. Keep your own records. Do not rely on a healthcare provider to say you're okay.
Yeah.
Make prevention a priority. Detect problems early. Ask questions. It's your body. Start early. Don't wait until you are 50. Then you get your first health examination at the high school
Yeah.
age. Take advantage of free community health screenings or employer offered the health screening and benefits. Involve your family in your health. Be a role model to your children.
Oh, on that note, doctor, I understand you're a father as well.
Yes, I'm a father.
How many kids do you have?
I have one child. He's 7 years old.
Fantastic.
So
7. Boy or girl?
he's a boy.
Wow, nice, nice. So I bet he's watching this right now so that he knows how to take care of his father in case his father
Yeah,
any
definitely.
unhealthy habits, he can be the one to say, "Oh, Daddy, you
Yeah,
cannot
yes.
do that." Mother's Day advice.
Yeah, definitely.
Yeah.
So
This is a very good topic, actually, doctor. Thank you so much for suggesting this. It's very relevant.
correct. So I usually, when I see patients or anyone in my clinic, I usually advise them importance of the medical checkup. So medical
Yes.
checkup usually consists of a blood test, physical examination,
Mm.
uh, and also imaging. So we will see the patients, we will take into the account of all the complaints, and then we will advise them what kind of a medical test or physical examination is necessary for them. So come to the topic medical checkup. So we usually advise them to get approach the physicians or even the healthcare providers.
Okay, for someone who is not sure, they want to go and check the health, but they're not sure what to do because they've never gone for any screenings before. So they can just go to the hospital and then make an appointment at the health screening department, see the doctor, and just tell the doctor what are the concerns. And then from there, the doctor can recommend what type of packages, because Columbia Asia has got quite a few packages to accommodate different types of patients, male packages, female packages.
Yes, absolutely. So once they don't have anything to be concerned about, they just want to check their general health condition, they can approach
Yeah.
health screening department and then let the counter know that they want to do a medical checkup. Then we will advise
Yeah.
them to do a
Yeah.
basic medical checkup, and from
Yes.
there we can pick up things which is not correct. If everything's okay, then we'll advise them to do a routine checkup yearly once, 6 monthly. If it's necessary, if there are any problems, we'll see them as early as much we can.
Yeah. Okay. Great. Great advice. Do we have any more topics, doctor, in this topic among
Yeah,
topics?
I just touch a little bit about the food and also water intake and also
Okay.
exercise.
All right.
So food is essential to life, therefore we make it good. So diet and nutrition, the only truly effective way to lose weight is to reduce the number of calories you eat and get more exercises. So we usually advise them to eat fruits, vegetables, whole grains, fat-free, low
Yeah.
fat milk and milk products. So eat
Right.
lean meat, poultry, fish, beans, eggs, and nuts. Limit intake of saturated fat, trans fat, cholesterol, salt, and added sugar.
Yeah.
So thousands have lived without love, not one without water. So the saying goes to how important the water is. So health benefits of drinking water: better fat metabolism, decreased cravings, flushes toxins from the body, healthy skin and complexion, and many more. So benefits of
Yeah.
water is really, really important.
How many
So
glasses of water do you advise for everyone to
usually,
drink?
I guess the common saying is actually 6 to 8 glasses of
Okay.
water a day and all is sufficient. So, but we'll see how's the necessary. Some people will have, as I told you, like any patients with the heart conditions and all, there's a restriction of is there. So better check your heart conditions before
Oh, I
consuming.
see. I see. So it's
So
not the same for everybody.
yeah,
It
not same for everybody. Some
differs physiology.
people we will advise them to take more water. Those are dehydrated and all. Some people, those who
Okay.
have heart failure symptoms and all, so they
Yeah.
have to reduce the fluid
Oh,
per
I
day from
see.
500 ml
Right,
to
right.
750
But on
ml.
average, 6 to 8 glasses lah.
On average, 6 to 8
On average.
glasses.
6 to 8. Okay. Right. Cool.
So exercise and fitness is important aspects. Before starting any exercise program, talk it over with your healthcare provider for guidance. Start out easy. You may only be able to do 5 minutes per day, gradually increases your workout capacity until you are up to 20 minutes or more per day.
Yeah.
Exercise at least 2 times per week. Any kind of activity, even mowing lawn or washing your car or walking the dog, is better than none. So when we see the difference of what exercise make is actually the improve our sleep quality. Average resting heart rate will be maintained. When you do exercise, the average heart rate will be reduced and maximal oxygen uptake. Average daily calorie needs also will be increased, and also life expectancy will be increased. And most importantly, you sweat a lot when you work out.
What about yourself, doctor? What kind of exercises do you do?
So during, I like to do physical exercise like jogging, going
Okay.
for regularly to the gym to do weight building exercises, and also Tabata kind of workouts and everything. So
Wow, that's very high intensity.
yes,
Tab-
high intensity hit workout
Calorie
and all.
burning.
So this kind of
Wow. Oh, not bad you doctor. Susah tu Tabata.
very difficult, but then slowly
Yeah.
everyone will start slowly. So you can
Yeah,
do
yeah,
4 minutes to 8 minutes. Then you can
Mm-hmm.
gradually increase your intensity.
I see. Okay, doctor. Since we've got quite a few questions here, maybe we can just go to the questions before
Yes.
before we summarize. Okay, there is one question here by Encik Fakri Hamzah. I want to ask on common things that happen to men, which is back pain. I got back pain until today because of weightlifting 2 months ago. Oh dear. No symptoms of slip disc. Any thoughts, doctor?
Okay, back pain in a men, actually, we need to do a proper physical examination first, and also come together with blood investigations or even urine examination. So, usually, back pain associated commonly with the slip disc, with the mechanical back pain, and another important thing is actually ureteric colic, stone diseases, and all. So, we need to get a physical examination, thorough physical examination, uh, blood investigations, urine analysis, and also we'll go into the imaging if it needed, like X-rays of a lumbar sacral, and also MRI to see really is it like a something to do lower back pain with a prolapse intervertebral disc disease or any ureteric stone disease or what. If it's everything done completely, then we'll get a clear picture of what kind of a back pain is that. Is it a mechanical back pain, something to do with the muscle strain, or is it really something to do with a nerve associated problem like a lumbar disc degenerative disease or ureteric stone disease or what. So comes
Yeah.
basically we need to do thorough physical examination, and also all types of investigations need to be there to give a proper diagnosis.
Yeah. Okay. Thank you. I hope that answered your question, Dave Fakri Hamzah. There's another one by Miss Chris Fusini, 38 years old. 38 years old, swollen legs when I goes away a few hours after laying down. What do you think of this, doctor? I think,
Yeah,
okay, he's 38 years old, he has swollen legs. When he stands up, it goes away after a few hours after he lies down.
yeah, it's a very what do you call it? Very common condition, swelling of a lower limb. It can be
Yeah.
benign, can be very serious condition as well. So back to the basics, we need to know
Yeah.
what kind of swelling is that. We call it edema in medical term. So is it like
Yes, yes, yes.
something to do with the inner organ problems like a
Mm,
kidney
mm,
or heart or even liver? So we need to check the numbers first, and we need to do imaging to see how's our organ condition. Is it something to do with the congestive heart failure or kidney failure is with this heart, or even the liver problem and everything? So once we know our inner organs in a good shape, probably it's because of other conditions like long-standing venous problems and everything. So that's why I think like, is it like a serious condition or not serious condition based on examination and also numbers. So
Yeah.
then only we will see we can definitely or surely we can tell is it like a serious condition or not.
Yeah. So again, we need to go for health screening lah to find out the cause of
Yes,
something.
go to the health screening and see whether any organ involvement, organ damages or not. If no, means we will do an ultrasound of the leg and see any like a lymphatic blockage or what, which is a
Yeah.
benign condition we
Yeah.
can correct it.
Okay, all right. So, Mr. Chris Fusini, if you are in JB, of course, you can always go to Iskandar Puteri. We've also got another Columbia AJ branch in Interbrow. So, both of these hospitals have health screenings to help
Yeah,
you
correct.
sort out your problem. Yeah. Okay, there's another question here. This is by Ms. Gwen Yap. Is jogging and badminton recommended for older people? My dad is about 76 years old and he still jogs and plays badminton a few times a week. Wow. Should I be concerned about his bone health? 76 and plays badminton.
96 and still active is
Amazing.
something is amazing, and we need to give a great applause to your father.
Yes.
So we will encourage them to do all kind of activities up till their limit. So if they have experienced any type of pain, especially on the joints or what, we'll advise them to do a checkup, to do a screening, to see any problems like osteoarthritis, any like a fragility in the bone and everything. If they don't have any problems, such conditions, we won't stop them. We won't like ask them to do any type of other activities. They just can continue, no issues on that. But just make sure their conditions. And we in our hospital we do provide them a bone DEXA scan where they can see the density of the bone, and then based on that we can actually recommend them to continue the physical activity or not. So
Okay.
recently we launched the service bone DEXA scan. So people can actually use this opportunity to check their bone density.
Oh, yes. Okay. Yeah, I saw the posters, the bone density promotion. That's very good.
Yeah.
Okay, I've got a message here from Mr. Chris just now. I also have. He's mentioning there's a hemo. Maybe we can put this across the screen.
Yeah.
I also have. Okay. What's your take on this? This is
It's a blood,
the gentleman that was asking the question earlier.
Yeah, this is a blood associated problem. Usually we ask them
I
to
see.
liaise with a hematologist, get their full status known, and then they will recommend you. So everyone will have a primary doctors. So do you have any condition? Please consult your primary doctors. The primary doctors will advise you on what kind of conditions you are having, what kind of physical activity you actually can do, and what is the prognosis and everything. So primary doctors will definitely advise you on this kind of condition. So the problem is actually for the general society, those who don't have any kind of problems, they can do a physical examination to get their self-testing. If you have any conditions, actually you will advise them to get a primary doctor's opinion first, or even their advice first.
Okay, fantastic. Okay, well, I hope that answers that puts aside any doubt that you may have, Chris, and also Ms. Gwen Yap. Thank you so much for all your questions, and thank you, Dr. Asokumaran, for being with us. Before we let you go, let's just ask a few questions lah. Since you've been giving us a lot of solutions today, and it seems that you are very passionate about everything that you have imparted.
Yes.
So, have you always wanted to become a doctor?
Yes, I always wanted to become a doctor, and it's also my mother's and my parents' dream.
I see.
To become a doctor. So I'm very glad to be in this field, especially I can help a lot of people to get back into their health, on their track, on their health, especially on their health aspect and everything. So every day I'm helping people to sort it out, their health issues.
Yes.
So this is a very pleasure for me to be in this field to help the society.
Dream come true lah. You achieved your ambition.
Yes, can say it like that.
Okay, any wish, since it's going to be Father's Day soon, so any wishes that you may have to any father, your father ke, siapa punya father, or just all fathers in general, please take this opportunity to say so.
I'll take this opportunity. Thanks for the great opportunity by Columbia team to give this health sharing session on, especially on the Father's Day. So I take this opportunity to wish my father, Mr. Moorthy, happy Father's Day, And all other fathers, you are great, you are doing great, and please take care of your health. Everything will be, especially in this pandemic, I'm wishing that I wish that this pandemic over as very much sooner, so we'll have quality lives again soon.
Thank you very much, Dr. So, and as a frontliner also, we are very, very indebted to you, because here you are at the hospital when the rest of us could be working from home, since it's PKP. So stay safe, Dr. Aso, and to everyone as well, stay safe. Thank you again, Dr. Asokumaran Moorthy from Columbia Asia Hospital, Iskandar Puteri, medical officer, and you can just go and see him anytime about health screenings based on what we spoke today. Thank you again. See you next episode. Bye-bye.
Thank you. Bye.
Bye.